Greetings dear viewers. In this video, I would like to explain about the dengue virus and its infections, majorly called as breakbone fever. I am Dr. M. Manikandan, Assistant Professor from the Department of Microbiology, Sacred Heart College, Tirupattur. Introduction. Dengue is a mosquito-borne infection caused by a single-stranded RNA virus belonging to the Flaviviridae family known as dengue virus. That is DENB. The dengue virus has four antigenically distinct serotypes, that is DENV 1, 2, 3, and 4. A fifth serotype has been detected in Malaysia in October 2013. The disease mainly occurs in tropical and subtropical regions with approximately 390 million dengue virus infections per year, of which 96 million are symptomatic. Dengue virus has become one of the most widespread mosquito-borne diseases across the world, with incidence increasing 30-fold in the last 5 decades. It is endemic in 128 countries currently, mostly targeting the developing countries. The most prevalent regions include America, Southeast Asia, and Western Pacific, while Asia itself harboring almost 70% of the disease incidence. The highest number of dengue cases globally was reported in 2019. Mode of transmission. The transmission of the dengue virus occurs through the bite of female mosquitoes of the genus Aedes, primarily Aedes aegypti, followed by Aedes albopictus and Aedes pollinaceans. Depending on the geographical region, it may vary. After feeding on a dengue-infected individual, the virus replicates in the midgut of the mosquito, reaches the hemocoel and hemolymph, and further disseminates to the other secondary tissues like the salivary glands. Studies have shown that the presence of viral particles within the nervous system, salivary glands, foregut, midgut, fat body, epidermal cells, ovary, and internal body wall lining cells of the mosquito, whereas their absence seen in the muscles, hindgut, and malpighian tubules. The extrinsic incubation period (EIP), which is the time taken from entry of the virus to actual transmission to the new host, which takes about 8 to 12 days, with temperature between 25 to 28 degrees Celsius. Once a mosquito is infected with the virus, it is capable of transmitting the virus throughout its lifetime. Structure. The dengue virus genome consists of a single-stranded RNA genome, which is surrounded by an icosahedral capsid and enveloped with a 40 to 65 nanometer in diameter. The viral envelope is embedded with the 180 number of E and M proteins. This genome consists of 10 genes that are translated into a single polyprotein that encodes for 3 structural proteins and 7 non-structural proteins. The 3 structural proteins are capsid, premembrane, and envelope. The 7 non-structural proteins are NS1, NS2A, NS2B, NS3, NS4A, NS4B, and NS5. Pathogenesis. Most primary infections of dengue with a certain serotype are asymptomatic and only lead to mild febrile illness, although some individuals can develop hemorrhagic fever. Secondary infection with a different serotype may, however, lead to severe clinical manifestations like dengue hemorrhagic fever or dengue shock syndrome, because the viral particle consists of 4 different serotypes and also added with the fifth serotype latest. An individual develops immunity after infection from a serotype against it. However, they are still prone to future infections from the other serotypes of the virus, as the heterologous immunity declines gradually in 1 to 2 years. Many viral components as well as host factors contribute to the pathogenesis of dengue virus, such as the non-structural protein NS1, dengue viral genome variations, subgenomic RNA, antibody-dependent enhancement, T cells, anti-dengue NS1 antibodies, and autoimmunity. After the virus enters into the bloodstream of an infected individual through the mosquito bite, it infects the nearby skin cells as well as specialized immune cells known as the Langerhans cells. The viral antigen is then presented on the surface of Langerhans cells that travel to the lymph nodes and help activate the innate immune response. The dengue virus further infects the macrophages and monocytes and further disseminates throughout the body, which results in viremia in the individual. Clinical symptoms. Dengue infections may be asymptomatic or symptomatic, causing the clinical courses of illnesses which passes through three different phases, in which the initial phase will be febrile phase, causes undifferentiated fever and classical dengue fever. The second one is the critical phase that causes dengue hemorrhagic fever or dengue shock syndrome, and the final stage is the convalescent phase. Phase 1, that is a febrile illness during which a undifferentiated fever will be found with the prodrome of chillness, erythematous mottling of the skin, and facial flushing, a sensitive and specific indicator of the dengue fever. The prodrome may last for 2 to 3 days. The During the febrile illness, the secondary infections, classical dengue fever begins with a sudden onset of fever, high fever, severe headache, chillness, arthralgia, myalgia, anorexia, abdominal discomfort, vomiting, and macular papular rashes in some cases are seen. The fever lasts for 2 to 7 days and may reach 41 degrees Celsius. And also, the fever lasts more than 10 days may lead to the next condition. Phase 2, that is the critical phase, occurs after the initial febrile phase, during which a dengue fever or dengue hemorrhagic fever patients usually go to a critical phase after 3 to 4 days of onset of fever. During this critical phase, plasma leakage and high hemoconcentration are documented, and patients may develop hypotension. Abnormal hemostasis and leakage of plasma leads to shock, bleeding, accumulation of fluid in pleural and abdominal cavity. The infected dengue fever patients may experience different kinds of abnormalities, starting with vasculopathy, that is abnormalities in their blood vessels, thrombopathy with impaired platelet function and moderate to severe thrombocytopenia. Next is the coagulopathy with activation of coagulation and fibrinolysis, and later in severe diseases, bone marrow depression has also been seen with reduced megakaryocyte production mechanism, suppressed megakaryocytopoiesis, and increased platelet clearance by dengue virus induced apoptosis, and antiplatelets antibodies are also seen. During the critical phase, patients also may have signs of a shock, including restlessness, cold, clammy skin, rapid, weak pulse, and narrowing of the pulse pressure, along with the nosebleeds, bleeding gums, and internal bleeding also seen in the critical phase. There is a high morbidity and mortality rate in the dengue hemorrhagic fever or dengue shock syndrome, which are commonly associated with various organ involvements and metabolic derangements. The period of plasma leakage usually persists for 36 to 48 hours. Convalescent phase, which is the final and recovery phase. During the recovery phase, the extracellular fluid which was lost due to capillary leakage returns to the circulatory system, and signs and symptoms gets reduced and health improves. This phase occurs after 6 to 7 days of dengue hemorrhagic fever and lasts for 2 to 3 days, that is 48 to 72 hours. Longer convalescence may be expected in some of the patients with severe shock, organ involvement, and other complications, which may require specific treatment. Patient may develop pulmonary edema due to fluid overload if the fluid replacement is not optimized carefully. Laboratory diagnosis. Early detection and treatment of the infection can prevent the development of severe manifestations as well as the death of the patients. Diagnosis of dengue infection based only on clinical symptoms are unreliable as it produces a wide range of symptoms that are often non-specific. The dengue infections can be diagnosed by RNA amplification tests, viral antigen detection by ELISA, or through rapid kit tests. The virus isolation, serotype identification, and nucleic acid detection are usually performed for diagnosis till the fifth day of infection. IgM antibodies are detectable within a week after infection and remains so for about 3 months and are indicative of recent dengue infection, while IgG antibodies take longer time to develop in the body but remain in the body for years and hence are indicative of a past dengue infection. Treatment and prevention. Specific treatment for dengue viral fever is not yet available. Fluid replacement and antipyretic therapy with paracetamol or acetaminophen can be used during the febrile phase. Usage of crystalloids make up the first line treatment, which is the choice of intravenous fluid. A major concern of bleeding in patients with low platelet count must be managed by transfusion of fresh whole blood. The prevention can be made by controlling of mosquito vectors, and individuals can use mosquito repellents, insecticides, coils, vaporizers, oils, window screens, etc., which must be used to prevent mosquito bites. Dear viewers, thank you for your kind and patient listening. Kindly subscribe to our channel and improve us by giving your valuable suggestions in our comment section. Thank you.